As we age, most of us need glasses. But what about our children and grandchildren? We took a closer look at Pediatric Ophthalmology with Dr. David Sami of Children's Hospital of Orange County to find out what problems children can have with their vision.
The most typical eye problems that we get are children who begin to cross their eyes when they're around 2 to 4 years of age. Also, in the earlier age category, we see a lot of babies who have nasolacrimal duct obstruction, where the tear duct hasn't opened up fully and the eye tears. Those are some of the most common things we see. Also, there's an increasing number of premature babies, so we see a lot of babies who are seen and screened for the complications of prematurity. And one of those complications is retinopathy of prematurity. It's a situation where, because of the environment that they're in, which is outside the mother's womb, the retina grows abnormally, and if not detected in time, can cause detachment and blindness. And there are very famous people like Stevie Wonder, for example, who lost his vision because he was a premature baby, got some excessive oxygen as an infant, and went blind. When babies are born, they typically don't see well. And over the first 3 to 6 months of life, there's rapid visual development. The time from 3 months, where they sort of gain neck control, to 6 months is a really important time in their development, where they're starting to learn to use both eyes together and becoming aware of their environment. A baby that doesn't make eye contact with the parents, doesn't have a social smile, is usually a big warning sign that something may be wrong. It doesn't mean that it's always wrong. There are some babies who start to see a little bit later than others, and we don't know why. Parents often ask, my kid sits too close to the TV. Should I be worried? And the answer is, it depends how close. A good rule of thumb is that if the child is sitting so close that he has to move his head to see the whole screen, is probably too close. So sitting 3 feet from a 20-inch TV is probably okay. Sitting 3 feet from a 60-inch TV is not okay. The approach to the treatment of strabismus hasn't changed much in the past 30, 40 years. Our surgical techniques have improved, and our understanding of some of the mechanisms has perhaps improved, but we don't really exactly understand all of it. What we do know is that there seems to be 3 categories of kids. Those who cross their eyes because they need glasses. There are some kids who cross their eyes because they need glasses, and you give them the glasses and they're still crossing a little bit, and those end up needing a little surgical intervention on top of it. And then there are those kids who cross their eyes even though they don't need glasses, or you give them the glasses and it doesn't make the difference. Even though there is a lot of awareness of the need for early intervention in the community, I still see a lot of kids who get to us a little too late, and that's why we continue to go out there and tell parents and doctors that if you detect a problem, that you should intervene as early as possible, because kids are developing vision, and even a few months delay in those critical months of life can make a difference.